So good afternoon. Welcome to another episode of the series of On the Sofa with Rouge with the Infinity Group. It's wonderful to be here today again at the Infinity Aesthetics on the Ocean Village Promenade. Episode 1 was with Dr. Krishwawal, and we talked about men's health, and we discovered quite a lot about men and what they aren't doing and what they should be doing. And today we've got dental therapist, is that right, Amy?
Yes.
Amy Mesilio Peralta, who's here with us today. She's quite new to the group, and I want to hear everything that she is doing here for the group and how you can become more beautiful aesthetically with your smile and your face. So I always think of it, by the way, welcome.
Thank you for having
you so
me.
much for coming. So yeah, I mean, you're making people beautiful.
Well, I hope so. I'm just making them even more beautiful than what they are, I guess you could say.
Is that that's how you see it?
That's how I like to see it, yeah. I wouldn't like anyone to come in and say that they're not confident or that they think that they're not attractive or super ugly or anything like that. I would always like to think that they come in hoping that they can just maybe feel a little bit more confident within themselves, which is always the target.
How I guess, first of all, are you a dentist? You're a dental therapist?
I'm a dental therapist. So I was the first one actually in practicing in Gibraltar. Now luckily there's 3 of us, which is really, really nice. So a dental therapist varies from a dentist in the sense that a dental therapist can carry out the similar scope to that of a dentist, but we don't go into sort of like root canals, extractions on adult teeth, and anything that involves like prosthetics like dentures and stuff like that. Okay. So I still do fillings, extractions on kids, and routine dentistry, and then obviously hygiene appointments as well. Okay, and you've also learned how to do all these beauty procedures. So is this like an extra? So I suppose your degree would be in dentistry, and then you specialize in... Yes, so my degree was actually in dental therapy. I also did a year of biomedical science, so I have a certificate in higher education in that. And then recently, about a year ago, I finished a diploma in aesthetic therapy, which is basic aesthetic dentistry, where I focus on composite veneers and just in general like whitening and a lot of aesthetic procedures. Facial aesthetics and dentistry kind of go hand in hand, because at the end of the day it all is to do with the face and the same muscles. Obviously there are different muscles involved, but it sort of opened up a window, and I do really enjoy it, and I think I just have this special interest in the world of aesthetics, so I went for it, and I'm really glad I did.
I bet you are, because I mean, you see, it's all the rage now. Everywhere you look, every magazine, every kind of Insta reel, it's something to do with beauty, something to do with lip fillers, and actually you see people around that you're used to seeing, and suddenly you think, oh, they've done their lips.
Yeah, there's something different.
There's something different about them. So more younger and younger people coming for treatment, because I've noticed younger people getting things done.
I think I don't know if maybe younger people are getting maybe more stuff done, or maybe it's just not as taboo of a subject as it used to be. Obviously when I was younger, I was always thinking like, oh, like I would never do that, but the problem is you do need to be careful with who you're going to, who your injector is, and who the person that realistically is doing the treatment. So I always think that you can get really, really nice, natural, lovely results which don't change your face but just maybe enhance your features. A lot of the time what people just need is basic like TLC for their skin, which sometimes could literally just be having enough water. Like how many people probably don't drink enough water for their skin, or don't drink enough, you know what I mean, like 2 liters of water a day, or don't take or even sun exposure, you know what I mean, like you should be wearing a factor 50 on your skin every single day. Whether it be summer or winter, you do need to protect your skin, especially your face skin.
So you know, the last time I came here and we did a little thing, I think it was with Maria, I put my face in this.
I did too, and I was shocked. I was not happy with that.
Dav and I, because sometimes I do it with Davinia, and we both had a go, and it was very interesting to see what the age of your face really is. So mine was spot on, actually.
That's good then.
Yeah,
I think I was like 10 years older.
I would have liked to have been a bit younger, but anyway. But I mean, they were telling us that there's a lot of things that you can do just to. So, what do you prefer, Amy? From all that you've studied, what do you prefer doing?
Obviously, dentistry is always going to be like my baby. I wanted to be something in dentistry since a really, really young age. It wasn't an easy process to get into it. I wasn't one of those people that are really lucky that sort of get dentistry the first time round. I had to go through a couple of different pathways, but I suppose you end up where you're meant to be. And
where did you study?
So, like I said, I did a year of biomedical science in Bristol, and then I moved up to dental therapy in Preston. So I did that, and then when I was in the dental therapy course, it was integrated with the dentistry course, and my aim was to do dental therapy and then go into dentistry. But I was so happy with my scope in dental therapy. I came back to work in Gibraltar. I got a job, and I can't really imagine doing anything else. So
you're loving it.
Yeah, but at the same time, aesthetics is a lovely, lovely part of the job as well. Mainly because, like I said, you just give people that bit more confidence boost.
And you work now for the Infinity Group, so they have this really nice boutique salon here in Ocean Village, which is like a stone's throw away from town.
I literally remember before it even opened, I was walking through Ocean Village, and you would only see, I think it was the sign, and I just thought to myself, that clinic is an absolute dream. And little did I know, 2 months later I received an email asking if I wanted to work here. So
but the amazing thing is about this establishment is that lots of people work in the area, so they can come and have their little treatments, like a little treat at lunchtime. So tell me the range of different things that you can offer people here in the clinic.
So I've only been doing it for a couple of years, and I was actually taught by Victoria Walker. She's also based in Gibraltar. She actually moved from the UK to Gibraltar, and she's honestly incredible to learn from, to watch the treatments that she does. She's really, really good. So what I offer is basically Botox, which is botulinum toxin. I offer skin boosters, and I offer as well fillers, so dermal fillers. I'm looking into studying a little bit more because the window is a wide range of things to do.
So fillers, not for the lips?
Yes, that as well,
what a derm, I don't know the difference, sorry.
It's mainly it's the same thing. I guess it's more like the technical term for it. So I obviously do lip filler, which is underneath the dermis space, so it's called dermal filler. So I do lip filler, and I've also done filler just to fill in the marionette lines, which is cover around
exactly what I need, because mine are quite bad. So that's what people are. Is that what people ask for?
People mainly go for lips, and I do have, I think, my lip sort of like clientele, or my patients are in the younger range, especially.
What happens when somebody comes in who has a nice, beautiful mouth anyway, and they're asking you to put more filler in there?
I'm not scared to say no.
Really?
I'm not scared to say no.
That's really interesting, because I always say, why has she done that? She's beautiful anyway. Why would she stuff more of that stuff in there?
I can think of a few. Where I've told them that I think they're perfectly fine. They're absolutely stunning. It's their body at the end of the day. You can do whatever you want, but I wouldn't recommend it, and I'm not scared to say no that I wouldn't do the treatment. If they go somewhere else, it's completely up to them. But I'd rather give, and I feel as if a lot of patients do take a professional opinion.
They do.
Yeah, they would.
They're serious about it.
They would take a professional opinion. Obviously, if they've gone and done it somewhere else, I don't know. But
of course. So you would tell them if you think it was.
Yeah, definitely.
But it does really enhance, no?
It depends. Realistically, you can get 0.5, and for some people, they might not notice it, and then for them, you might notice it. It's a bit maybe like when you buy yourself like a new necklace or something, and you just got that feeling of maybe having something new, it's just that feeling, I think, is what it gives them. But you can do really nice, natural, discreet results and still give them the same confidence boost as if it was in someone's face, basically.
Yeah. And does it run out, or do you have to keep it up?
So Botox, the lip filler, realistically, the first time you ever have hyaluronic acid done, hyaluronic acid is super, super hydrating for the skin.
Okay.
So for the body, realistically. So the first time, I always tell my patients, if it is your first time having any form of hyaluronic acid, your body will break it down within about 6 weeks. The reason being is because obviously your body's like, oh, this is really hydrating, it's full of nutrients. So the first time people do have lip filler done, I always tell them, don't be disheartened if you feel like your body does break it down quite fast. At the same time, if you're
meaning that it'll disappear quite quickly. Okay.
Or maybe not disappear completely, but enough for you to feel as if you don't have anything.
And this is normal because the body wants to absorb it. The body's like, what is this? No,
so it's really hydrating. It's super hydrating. I think hyaluronic acid has become quite a fad at the moment. A lot of people know what it is.
Yes.
Like a couple of years ago, I didn't know what it was.
It's in a lot of creams as well, isn't it?
It is. Yeah, it is. There's many different types of hyaluronic acid. There's cross-linked. There's non-cross-linked. So some people sometimes hear hyaluronic acid and they're like, oh my god, I don't want that because it's going to make my face oil. And there's many different types of hyaluronic acid.
Apart from the lips, what other treatments do?
So I do Botox, and we can do weird and wonderful things with Botox.
Really?
Yeah.
You say it like you're really like.
Yeah. I think
you really enjoy it.
Yeah, I do really enjoy it. I do really enjoy it. So some things obviously we do for Botox is obviously we reduce any wrinkles, and we can sometimes help people sort of like lift their eyelids to basically create a fox eye. We can do nose slimming. where we make the nose appear a bit slimmer.
Really?
We can do a nose tilt, where we basically lift the end of the nose up. We can do jaw slimming, where we make
That's
the jaw...
incredible, because then people don't have to pay for having to have a nose job. Or...
Yeah.
And how long do these procedures...
So the procedure probably takes between 5 to 15 minutes is what procedure Botox takes.
Oh, really?
Yeah, it's really, really quick. It's normally painless, or if anything, a small pinch. Like, I honestly think getting your eyebrows plucked hurts a lot more. And they tend to last, 12 weeks.
Okay.
Yeah, a lot of people, where they're mistaken with Botox, is that they think they need to be frozen for those 12 weeks. That's not the case. So Botox, when you first have it done, you won't notice anything for about a week. So
what do you
after
mean?
a week,
That you won't feel it, or
the Botox doesn't kick in for a week.
Oh, I
So
see. But you would feel maybe tightness or something in your face.
No, not until the first week. When you maybe wake up on that 7 to 10 day margin there, maybe you start noticing maybe you can't wrinkle as much, you can't like frown, you can't. That's what you start noticing. It peaks at 2 weeks.
Oh.
So the way that I like to work is, if it's a new patient and they're having Botox with me for the first time, I will always under-treat them, and I'll always treat them within a safe area along their face.
Yeah.
So what that means is that I'd rather them come back in 2 weeks and say, Amy, I want a little bit more because I still have wrinkles, and say, Amy, you put in too much, I feel a little bit awkward. So I'll always under-treat, I'll always try and keep quite safe in that sense, and I'll also always stay within the safe zone. So I was taught that way, and that's why I think it's really good.
And talking about safety, are these toxins that you're putting in, are they quite safe for your body?
Yeah, they are safe. Your body breaks it down, like, you metabolize it how you would anything realistically. They are safe. Your body does break it down naturally, and like I said, after the 12 weeks, your body just basically gets rid of it. So
okay. And another question: what about men?
Yes, I get men.
I'm sure you do, because I see more and more men, and when you look at them closely, you can tell that they've had something done. I mean, it's obvious. Well, especially some people that I know that are my age, and I think, oh, I think his skin looks really good. So you're getting more and more men. And what age are these men that are coming in?
They're normally a little bit older. They're not as young as sort of like when the women start. They're probably, I would say, about their mid-30s. Then again, jib is small. And I think jib, maybe a lot of people don't want people to find out, or it's maybe not embarrassing, I'm not sure. So maybe a lot of them maybe do go to Spain, it depends. So obviously I think maybe my target audience is a little bit smaller in that sense, so I can only give what I'm used to.
Of course.
They tend to be more in their 30s, drawing up maybe to 40s, around there.
And they're not embarrassed to come and see you, like a gorgeous young girl, and they're like, I'd like.
Yeah, some of them, like one of them was basically doing it for his girlfriend. So she was really, really, really sweet. It was a really nice appointment, and he was really happy with the results. He's come back a few times actually, so he keeps up.
What has he had done?
He had his forehead done, so his frontalis muscle done. Yeah, so basically just had like the wrinkles, and obviously we have to treat the eyebrows as well. Okay. So because you have to treat those, if you treat the forehead, you have to treat the eyebrows with it.
Okay.
Yeah.
It's interesting.
Yeah.
And what about the cheeks? Do everybody? Because I see a lot of people as well with very high kind of in here, and
that would be.
And some of them, the thing would be Madonna. Like, the example would be Madonna, who looks a bit like too much.
I actually haven't done the qualification in that one, but I think the people maybe that look too much is maybe just because they've had too much. Do you know what I mean?
And that can be a thing.
Yeah. Like, honestly speaking, like the world of aesthetics, if you get a really good practitioner, one that's not scared to say no, and one that can tell you realistically the results, like I said, they are nice, they are natural. You shouldn't change a patient's face, drastically, unless obviously the patient is asking for that.
It's enhancing, no, I suppose. And it makes people feel good. Do you think? Yeah. Do you think are the younger generation more self-conscious than the older ones?
I definitely think possibly. At the end of the day, I think we see it everywhere with social media. I think everyone just has this thing where you see in social media these perfect models, these perfect people, everything airbrushed. So I think maybe society does have a bit more pressure within the norms, but then again, I suppose it's within yourself. Do you know what I mean? Just to, at the same time, I suppose if you go for a facial, or if you go to get your teeth whitened or your hair done, you're still treating yourself. You're still going to maybe look better. Just maybe there's more of a negative view on aesthetics to sort of like maybe having your hair done, or having...
I think everybody should do whatever they want. Yeah. And I think the point is to be happy in life. No?
Yeah, exactly.
So you can be happy coming to this little clinic.
You can,
on the Ocean Village Promenade. And come and see Amy. What other treatments can you recommend, Amy?
Skin boosters are really
do you do
good.
those as well?
Yes. I actually got married a month ago.
Oh, congratulations.
Yeah, so I did a course of skin boosters on myself and I loved the results.
Really? And what do they involve?
So what they do is they hydrate your skin, they stimulate collagen, they sort of give your skin a bit more elasticity so your skin just looks fresh, you don't have sort of like a dull complexion. I really enjoyed it. They can also help reduce fine lines. So a lot of people sometimes opt for skin boosters, which is again hyaluronic acid, amino acids, peptides, rather than Botox, because Botox is a toxin, whilst hyaluronic acid maybe
is not. Yes, you can get
a lot of people call me and they're like, oh, do you have vitamins for the face? So I don't know if maybe that's how people see skin boosters as a sort of vitamin for a face, but it is nutrients which will help.
And is that injected or just like a cream? Oh, it is injected.
It is injected, yeah.
Okay.
It's injected very, very differently to Botox, and it looks very different to Botox, but it is injected as well.
What is it, like a finer needle? How?
It's a much thicker needle. So
needle.
It's thicker, yeah. Ooh. Well, maybe the needle's not thicker, but like Botox, for example, it's a liquid, and the skin boosters actually come within a syringe, and you just basically, it's known as a BAP technique, and you just put 5 injections around the face.
How interesting.
It is really interesting.
And then what, do you glow? Is it like a glowing?
People, yeah, it is glowing. It is glowing. So basically what we always say is your fibroblasts, which is sort of like what produces the collagen in your skin. Normally their turnover rate is every 28 days. When you get a bit older, those 28 days can sometimes extend. So what skin boosters do is they try and target the fibroblasts to bring you back to those 28 days. So that's why we tell patients you probably might not see results within 2 to 4 weeks of having the treatment. And we always recommend a course of 2 or 3 skin boosters. But honestly, I've had really good feedback with those as well. I don't know if you've ever heard of Profilo.
No, never.
So Profilo is a skin booster.
Right.
They're very, very good at marketing. They're Profilo people. So a lot of people sometimes ask for Profilo as a skin booster. There are loads of skin boosters on the market. Profilo might not be the best one that works for you, because obviously it depends on your age and the type of skin that you've got. And we just go exploring which one works best for you.
Okay, and you would know about what would suit different age groups.
Yeah, so mainly it has a lot to do with age, obviously how you take care of your skin. Some people might come in and their expectations might be a bit unrealistic. So you just need to say like...
You have to...
Yeah, you need to...
You can't just tell them in the face.
No. So you do need to...
That must be quite hard.
Careful. Yeah, I mean, I haven't had a lot of them, but there are some people maybe that, or maybe I think to them, I was like, look, you can give it a go. It does work on some people. It works maybe better on others than not. You don't know, but more or less you can gather how it's going to work. Yeah.
Have you had any negative or anything that people need to look out for when having treatments? I mean, even if they don't come here, but things that people should be warned about.
I wouldn't say being warned about. The only thing that I think is all across and the UK is that obviously you have to make sure that your injector is qualified. A lot of the times, just because they are a doctor or anything like that doesn't mean that they're 100% qualified, they probably know what they do, but a lot of times people aren't doctors that know about aesthetics or are that medically trained or just know a way around it. Always check, who you're having the treatment with, make sure that they are qualified, make sure you see their work, something like that. But in general, I think in Jib we're quite lucky wherever you go.
You said there was only 3 people like you.
Yes,
who are trained.
Yeah, there's 3 therapists.
3 dental therapists in Jib.
Yes.
And they're all young.
Yeah, they're younger than me.
Young.
Yeah.
So this is a very new thing, really.
It is really new.
I thought so. When I saw you on Instagram, one of your reels, I think you were injecting your friend.
Yeah, I was.
And I actually, you mentioned she's one of your besties.
Yeah, she is.
But the first thing that I thought was, but she's stunningly beautiful.
If I'm completely honest with you, she's got a phobia of needles. So we actually broke the needle, and it was completely for the video. I did not inject her. She would never in a million years let me inject her.
And I thought to myself, why is she old? And then I realized maybe they're friends and it's just for the advert.
They just grabbed me for the advert,
but I mean, I suppose people that age do come and see you.
Yeah.
And that worries me a bit, thinking that they're, maybe they have no self-esteem, or maybe they're
cheaper than the cure. So obviously, if you prevent, at the end of the day, it's the same as when I tell patients, like, you have to make sure that you floss every day, because at the end of the day, you're preventing gum disease.
Yes.
If you get gum disease, it's too late. There's nothing that we can do. Do you know what I mean? So obviously, everything in moderation. I'm not saying do a skin booster every week or have Botox but if you just want to maybe reduce the chances of getting fine lines or reduce the chances of getting those wrinkles which stay permanently forever, there are ways to have treatment that you can benefit from it, and it's not going to be of any risk to you or anything like that.
It's good to know. What are the main things that somebody should do with, like, the cleaning their face, with the daily routine, but something that everybody can do at home, for example?
I definitely think that's more on the girls section, but one thing that I would always recommend is sun cream on your face, factor 50 minimum. Just
on
obviously,
your face.
yeah, just obviously to protect yourself from a lot of stuff, from skin cancers, from basal cell carcinomas, everything like that.
Yeah.
Obviously the sun. It is damaging to the skin, so you just really take care of your skin in that sense.
I never put skin. I never.
Oh no!
I never do. And everyone tells me you're too dark. You should put. I don't know. I just don't like it. But I suppose there's other creams that you can use.
If I'm completely honest, before maybe studying aesthetics and stuff like that,
you didn't bother either.
No, I didn't bother. But my mom would tell me, and I would just be a bit like, yeah, whatever. But when you start looking into it a little bit more, especially I think in Jib, we do have quite a high rate of cancer. So I don't know what it is. Obviously, we live straight under the sun. In dentistry as well, you are taught about facial, so like skin cancer, because you can actually find it obviously when you examine the patient.
You're more prone to it here because the sun is out all the time from like April till October.
Yeah,
so
exactly. So that's the main thing I think everyone should just be aware of. Yeah, and obviously drink plenty of water.
I do that, so that's good. That's one thing. One thing I'm doing right. So what is next for you, Amy? I mean, you've just come back. Well, you've just got married, and you're back. You're working here at the Infinity Aesthetics.
Yeah.
What do you want to do next? What are your?
Last year I finised my diploma in aesthetic therapy. It was a year-long course, and now I'm just looking what to study next. So I always want to do something. Yeah, I really do enjoy kids pediatric, and obviously I did do pediatric dentistry. But in dentistry you do the wide range of dentistry, and then you sort of pick special interests.
Okay.
And aesthetics is obviously one special interest. So I think maybe pediatrics is another special interest for me, because I do really like kids. So, and I actually do like them in a dental setting as well. Like, a lot of people are like, oh, but what if they're nervous? And they're just fun. You know, I mean, they're a bit of a challenge. Their imagination grows. It's really good. I like them.
So you want to do that next?
Yeah.
And obviously you're staying here at Infinity Aesthetics for a while.
Yes, I am.
So if somebody was working in this area, like lots of people do, what is something that you could ask them to come and have done here, say on a lunch break, like apart from the skin boosters? Anything, no, because it's all...
It literally takes half an hour max, any treatment, realistically. Consultations take about 10 minutes, you know, if you're interested, and because obviously one treatment doesn't benefit everyone, you know what I mean?
Yes.
So at the end of the day, you can always come and get a consultation. You can see maybe what we could do for you. The girls here as well are absolutely incredible, like doing everything. I come here for my own treatments.
You do?
So, yeah. So
because it's everything, no? Aesthetics, so it's beauty and just the face or body as well?
They do body as well, yeah.
Oh, you concentrate on the face?
I concentrate on the face, If there's teeth near it, it's mine.
Okay.
I don't know. So, yeah.
But they can do body or everything else.
Things.
That's brilliant, Amy. Well, I really appreciate that you've opened up our eyes to what you can have done and all the treatments. Tell me one thing. Give me any advice that you've been given over the years that has stayed with you. Now, did you ever doubt yourself that you would? Did you?
Yes, aesthetics.
And were you ever told at school, "Oh, you won't do this. You're not going to pass that"?
Dealing with the public is really. It's difficult, you know what I mean? Like, you have a bad day, and obviously you can't take it into the clinic with you or into the room with you. You sort of have to leave it at the door. At the same time as well, I think patients sometimes forget that there is a person behind the mask or behind the gloves that's treating you.
That's interesting.
You know what I mean? Like, we can have bad days. We can. So, and one thing that I was taught in university was, you know how sometimes people are like, oh, it was like you're neglecting the patient. Neglect is when, if something goes wrong and you don't deal with it, or you don't try and help the patient and make it better for them, that is a neglect. If something goes wrong and you treat them and you help them and you offer them something, you give them free treatment for a couple of months, or you offer to call them up and just see how you're feeling, at the end of the day, you're only doing the best that you can do. So that is definitely something that stuck with me. But yeah, we are human.
Yeah, and you don't, for a minute, as a patient,
it's
not something I think of. I would go and see the doctor and I would expect them to, of course. you can have a rant there and not realize that actually that is a human behind that.
But it's actually quite funny because a lot of patients, maybe it's because me, I'm just really talkative, but like a lot of patients, maybe like if I ask them like how they are, like if some of them are stressed because they're moving house or they're getting married, you know what I mean? Like they'll tell you, they'll be like, yeah, I'm really stressed today, I'm in a really bad mood, this and that. So then it's like they project their problems on to you, and you literally take it and you help them, or you say, oh no, don't worry.
You're like a
therapist. There you go.
Psychological therapist as well.
Yeah. But at the same time, dealing with the public is also really rewarding. I love it.
Is that? I was going to ask you, what's your most favorite thing about the whole thing, apart from the dentistry and
I think I just
dealing with you're good at. You're a people person.
I'm a people person. Yeah. I love my job. Like literally, when I was on honeymoon, my husband was like, "Do you really want to go back to work?" And I was like, "Yes." And he's like, "You're such a fatigue." I'm like, "I know." Like I landed at like 10 o'clock at night, and at 8 o'clock in the morning, I was back at work, jet lagged and everything.
Well, you're really keen because you've got all this knowledge, and you want to get it out there.
And I think I just like helping people. If I'm honest, I like, as cheesy as it sounds, I like kindness. I like going maybe that extra mile for someone or helping them that little bit more. And like I said, I've always wanted to pursue something in dentistry.
Since you were little, why? Do you know why?
No.
Is there any little cute story there?
I always liked sciences. And the one story that I remember was when we were in school, we were having like a topic on like never judge a book by its cover. And I think it was just, you know how they not teach you not to bully, but they basically say like you never know what someone's going through, so be kind always. And I remember we were asked like what's something that you always notice, the first thing that you notice in someone, and a lot of people said their smile, and I did as well.
That's interesting. And
I think maybe that stuck. That's something I remember, so it must have just stuck with
I always look at that. Actually, a smile would lift your whole face.
It does. I've had loads of maybe patients that have come back after I've done like restorative treatment, and they're like, I got the job that I wanted, or I had the confidence to apply for the job that I wanted. So it is really nice. But the saying that when they say you love what you do, you'll never work a day in your life is very true. It's
so you're happy to work, and it's wonderful to speak to you and hear this. You must come down to Infinity Aesthetics on the Ocean Village Promenade and grab your appointment with Amy. So thank you very much, Amy.
Thank you.